Hey there, welcome to the show. I'm Dr. Dan Thomson. Thanks for joining me today on DocTalk. We're going to have a great show. My guest today is Dr. Jim Lillich, and we're going to talk about something that is here and futuristic for medicine. It's regenerative medicine. It's going to be a great show. We're going to learn a lot. Stay tuned.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Dr. Lillich, welcome to the show.
Thank you.
Folks, this is Dr. Jim Lillich. He's an associate professor here in the Department of Anatomy and Physiology at the College of Veterinary Medicine at Kansas State University. He's an incredible equine surgeon, does a lot with equine lameness, world-renowned, and today we're going to talk about something that's really exciting to me, and that's the application of regenerative medicine in horses and
where we take it from there.
Yeah. So kind of give us the rundown. What is regenerative medicine?
Well, it's a broad term, but basically it's trying to use what is within what's within the body in order to accelerate or maximize healing potential. So we know that wound healing is very, very complex and orchestrated by a number of different types of cells in the body. And what we're trying to do is use those cells and what they produce, and we can take them outside the body and grow them in the laboratory and then return them to the body so that the body can accelerate its ability to heal and maximize the healing potential. Rather than use other medications which really aren't necessarily designed for those things or help in some regards, but let's be honest, Mother Nature's a whole lot smarter than we are. So we're just trying to use what she gives us, know a whole lot more about that process to regenerate tissues. And from the human side of things, the biggest problem is regenerating the spinal cord injury because it's a permanent deficit. From animals, it could be the same things that we deal with, whether it's arthritic change in a joint where you're no longer athletically productive or sound if you're a horse. If you've got an infection somewhere that you need to beat, and that could be within any tissue, and it is not toxic to the body if you use these cells and use these products.
So talk to me a little bit about the arthritis and so give me just kind of like a little description of what I'm going to do, what kind of tissue you're going to take and
Sure. So every tissue in the body, virtually every tissue in the body has got some way to replace itself. So we call those generally stem cells, and there's a lot of different terms, mesenchymal cells or mesenchymal stem cells that are generated from fat. They even can come from muscle, but most of the time we're generating these from fat. All right, so we can take a piece of fat from you, and the cells that can reproduce in the laboratory in underneath conditions that grow them could then expand and help direct or become or help tissue that is back in the body heal itself. All right, so we regenerate that tissue by ramping up those little itty bitty cells that are supposed to do the job. We just give more of them.
Okay,
right?
so you're just taking them from one place and putting them where they're needed.
Exactly. And we know a whole lot more about what they require outside and what they require inside. So that there's other, what they're called cytokines. These are signals within the body and proteins within the body that ramp those things up and get them to do their job.
Well, if you can take some fat off me, which Lord knows I know is regenerative, and put it in my knees, I'd be happy.
Exactly,
with
that. And that hopefully will reduce the inflammation or cause the body to get better. Help maximize it.
All right. We're going to take a break, folks. When we come back, we're going to talk a little bit more about what we do know about regenerative medicine with Dr. Jim Lillich.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Jim Lillich, who's an equine surgeon, and he's an associate professor here at the College of Veterinary Medicine in the Department of Anatomy and Physiology, and he is doing some outstanding research and really cutting edge things in taking human application to equine application, and there's much more we can do. But when we're talking about regenerative medicine, taking cells from one spot in the body, putting them where we need help and where we normally don't get good regeneration and healing, Dr. Lillich is working on some things. So what are some things we know?
Well, so regenerative medicine's been with us for a while. There are some well-designed studies out there that document an effect, but we don't know exactly the metabolic or the exact mechanism of how that's going on. So Dr. Weiss, who's in my department as well, worked in the small animal clinic with a couple of the surgeons, and they did some fat cells derived in very damaged or hip dysplastic dogs. And the ones that were most severely affected, they seemed to improve. And it was statistically significant. So in the horse realm, we think that we can actually get potentially better tendon healing, things that are better for the joint, because wear and tear. I mean, athletic endeavors, you pay a penalty for that.
Right.
So if we can keep that system going, functioning at a peak, then we can get the most use out of it, and the quality of life can be better. Clearly that's what we're trying to do for people, is make their quality of life a whole lot better. So what we know is we can take cells, we can put them into certain locations, and we can now ramp them up, and we can improve the clinical conditions of an arthritis. We can improve a range of motion, or we can improve a level of comfort. Do we know exactly what's causing that yet? That's difficult to determine. I mean, we're looking at a molecular type thing. It's down below the cellular level to figure out if that is actually what's causing it.
So the signals from these cells, and I've got to get things down to kind of my level, but the fat cells or the different cells, they actually have the ability to send signals that might trigger the reaction in the cells that are locally working.
They're either directing the traffic,
okay,
or becoming part of the tissue, being incorporated.
Okay.
Because we think that since they're pluripotent, that means that they can go from one cell type to another cell type potentially, or fill some of a supportive cellular level role.
So we put these tissues in, and they either have the signals and the tools that the other cells need to do the job,
exactly,
or they're just going to do the job for them and jump right in and become part of that tissue that.
Yeah, certainly, and some of them could be calling in blood supply. We need more blood here. Some of them can say, hey, we've got a lot of inflammation in the area, and that's actually that's detrimental. Because inflammation is required for healing, but too much of it could destroy normal tissue or potentially slow the process. And we also know that the other side of the regenerative medicine deal is if we can get more comfortable, we can start to use the leg better. And if we use it and load it correctly and walk more correctly, hey, quality of life is improved, and we're probably stimulating healing in that regards.
Awesome.
Rehabilitation.
Awesome.
Yeah.
Folks, Dr. Jim Lillich here at the College of Veterinary Medicine. When we come back, we're going to talk about some things we don't know about regenerative medicine.
I'm Rexanne Struve, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis. I have joints that really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people because this is a phenomenal place to have this done.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We are Mike and
Martha
Armitage here at the A-Bar Ranch, Claremore, Oklahoma. We have a cow-calf production company, and we also have a marketing company. We have entertained groups brought to us by the Beef Checkoff, such as South Korean media that covered our operation and brought the good news back to South Korea.
That was a really neat experience, and that we got to have young people from another country that we got to experience a lot of different things in their culture, but got to share our culture too.
We live on the Squaw Creek Ranch. Here is a division of the A-Bar Ranch.
As a wife and a mother, and also with my background in more of a health field, I look at just the nutritional value, and it's great that the Beef Checkoff offers that kind of information to the consumers that are out there.
We both are proud to come from agricultural, more specifically ranching backgrounds.
My dad is a part of the Beef Checkoff board, and so the Beef Checkoff has been something that we promote and that we support what it has to offer.
Not everybody who's in agriculture is tech savvy on Facebook and through social media. Most people in the city happen to be, and they are very disconnected from our day-to-day routines, and that's one thing that makes me proud of the Beef Checkoff, them going to bat for us, from those who aren't necessarily anti-ag, but just simply don't know and they aren't getting the information.
As producers, we're strong supporters of that and hope that many of you out there realize all of the different things that the Beef Checkoff brings to the table for us as producers.
Fort Wallace was the fightingest fort in the West. Fossils, Indians, soldiers, scouts, wagons, trails, pioneers, stories. Discover the story of Fort Wallace and the people who served here, the people who fought here, the people who settled here. Wallace County, where the past is present.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we'll be glad to answer it and work with you.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jim Lillich, who's an associate professor in the Department of Anatomy and Physiology here at Kansas State University's College of Veterinary Medicine. And we're talking about regenerative medicine, where Dr. Lillich is an equine surgeon, understands joints, tendons, ligaments, different things that loading the leg and moving and being athletic. And you know, while we know some things that regenerative medicine can do, what are some questions we still have?
Well, I think these are solid, legitimate questions. How do you know that the cell that you're taking from the fat has now become part of the joint? You know, and that's a difficult question to answer, right? So how do we know we're going to be able to, you know, because some get better and some get a lot better and some just stay the same. Nothing certainly is thought that we've made them worse. So we want to know what the molecule is. We want to know all the way down to what is that cell doing and making, because potentially we can recreate that in the laboratory and put that stuff on the shelf, right? So it doesn't necessarily have to, you know, if it's a generic type protein that's not something the body's going to react to, you know, create an immunologic response to it, because that's how vaccines in part work, right? But if we can put that on the shelf, then we don't have to wait for, you know, gathering or doing a surgical procedure to harvest the cells. We can use some sort of manufactured process to stimulate the healing. So if we know that, then we can get just a little bit better still.
Yeah, so basically, like when we're talking about they're either providing the tools or they're incorporating in the tissue,
right?
We're going to go just get the tools, harvest those from that tissue,
right?
And then you could use it, you know, in animal or people
people, right?
Yeah.
And then we wouldn't have to use other medications. We wouldn't have to use a steroid. We wouldn't have to use, because there are toxicities associated with the drugs that make us feel better, right? You know, even from non-steroidal anti-inflammatories to steroids to, let's be honest, opioids, all right? I mean, yes, they're going to improve quality of life. Yes, you're alleviating pain, but there's still a price that you pay for taking those medications. If we can use something natural, then we really don't necessarily pay the price. So we don't know the exact cellular mechanisms. We don't know what a stem cell might need. We're getting much better at it, but outside the body to do and direct it to where it needs to go. Hey, we would like you to go into this bony area. We'd like to go into the joint. We'd like you to help us repair that, you know, and or in the tendon, or in the lung, or in, you know, heck, we could open up the door to the bovine mammary gland, the bovine uterus, you know, things that we can need to beat infections with.
I was thinking of
the bovine lung.
Respiratory disease would be huge
and
if we could.
And get away from the use of heavy antibiotics or something along that lines. Certainly better for animal safety, for food safety, better quality of life, doing a better job of managing our resources, being stewards of our animals.
The big thing is too is just saving the lives.
Exactly.
You know, having a positive outcome, and when we are struggling with coming up with some of the answers, I think there's some incredible opportunities.
I think that I think we need to begin to ask those questions, right? You know, can this be useful? Can this be something that we use? Can we take it, for, you know, with cattle, right? You know, can we take it from the cow itself or from the steer itself and ramp it up and give it back? Or can we make the molecule and put it on the shelf, and then they can be dosed or treated in a safe fashion?
Perfect. Folks, stay with us. We'll come back to our last segment on regenerative medicine with Dr. Jim Lillich.
Hi, I'm Randy.
And I'm Paul from PFI.
We would like to personally invite you to stop by PFI, home of Boot Daddies.
PFI is America's Western store, covering over 50,000 square feet.
Over 25,000 boots.
Visit Saddle City with the largest selection of saddles and tack anywhere.
A huge selection of hats at Big Spur Hat Company in PFI Town.
And choose from the best brands of clothing and accessories for the entire family.
PFI, located on Highway 65 at the Battlefield exit in Springfield. And I'm not kidding.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Beringer Ingelheim Vet Medica. Today, we're going to talk about colostrum. Colostrum is the first immunity that a calf receives in its life. Within the first 6 to 12 hours of life, we want that calf to get up and suckle the first milk from the mother. That first milk is what we call colostrum, which is packed with antibodies, which then help protect that calf from viruses and bacteria such as E. coli and scours, in which the calf will be exposed to on the farm. The cow is a great source of antibody because she's been living in that environment, been vaccinated for different diseases. She produces those antibodies in the colostrum. We want the calves to be able to get it in the first 6 to 12 hours. So wait to tag that calf until after that calf has had a chance to get colostrum, because it's vitally important for the calf's health, and it's the first step towards raising a healthy calf.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. We're talking about regenerative medicine. It's something that is cutting edge, that's the future. It's here and it's the future. And this is Dr. Jim Lillich, who knows quite a bit about it. He's an associate professor in anatomy and physiology here at the College of Veterinary Medicine at Kansas State University. He's an equine surgeon, world-renowned equine surgeon. We're lucky to have him on our faculty. We're lucky to have him here on the show. But so what are we going to do?
That's a good question for veterinary medicine. Certainly, they've poured a lot of money into regenerative medicine and on the human side of things. You know, Harvard's got a $2 billion facility, so that's billion. And where we're headed on the animal side of things, and I think we need to open the door more for the small animal side of things, because we know a whole lot more about what the horses are doing with that and whether that is helpful for the equine athlete. But for the companion animal, you know, the animal that's ridden on the weekends for fun or lives in the house with us, you know, the dog especially, I think we're going to begin to use their conditions and prospectively treat them. Can we harvest certain cells? Can we help those dysplastic dogs? And if we can find a way to make them feel better, they're in turn going to give us the information that's potentially going to help us. Certainly our lifespans are much longer than theirs, but you know, an aged dog at 15 is like the 75-year-old person potentially, or 85, and there's a big need to know that in human medicine, and certainly our pets are actually going to provide that for us, that information for us, those clinical trials that mean something.
Yep, and then there's some things that we can do with comparative medicine in this, so we can learn on animals and apply it to humans.
And hopefully if we can use what we know about the human stuff in the petri dish, or in the laboratory or where we grow the cells, and we can use that information back to help our companion animals as well.
Right.
You know?
Well,
so we have to ask those questions. Hopefully we get the funded research to get the questions in the molecular avenues that we see, that we need to know about, and then take us to the next step, you know, and that is more clinical trials, more directed therapy, refine it to the point where it's a known entity in what we're doing, you know all the mechanisms that are involved.
That's awesome.
Yeah.
Well, folks, regenerative medicine is something that is here. It's something that's going to change the future of both human and animal health. We have researchers like Dr. Jim Lillich here at Kansas State University that's working on it on a day-to-day basis. Him and Mark Weiss, tremendous research potential. We appreciate you watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us at www.doctalktv.com. Thanks for watching DocTalk today, folks. I'm Dr. Dan Thomson at Kansas State University, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.